Good morning. Welcome to your program agenda here on Cignal TV's One News, channels 8 and 250. I'm your host, Cito Beltran, thanking you for joining us this morning. Maraming salamat po to our Cignal TV subscribers. And of course, thank you to those of you who have been watching Agenda for what I understand is more than 5 years via Facebook and on YouTube. Maraming salamat po. And of course, thank you to PLDT for their home fiber optic internet. In case some of you may have been wondering, saan ka na naman ang galing, Beltran? Where were you yesterday? Why did Ed Lingao have to do the work for you? Well, it is because I am once again confined to quarters. I am self-isolating. I am here at home with SARS-CoV-19. Yan po ang katotohanan. Don't worry to my guests, hindi nakakahawa ang COVID-19 sa Zoom interviews. But that is the situation. I have been warning everyone for the last so many weeks, if not month, that COVID cases are on the rise. Ilang beses kong inulit yon dito sa agenda. Unfortunately, even when I was being proactive, wearing mask face outdoors, tinamaan pa rin ako, and even my wife got it. But thank God, because we are fully vaccinated with 5 vaccinations, we somehow had it easier than many of our friends. Yung mga ibang kaibigan natin said that they were down for many days. Kami naman po, Saturday was the worst. But beginning yesterday, we started feeling better. So that's it. We will be talking about COVID later in the program because there are certain concerns that I want to bring up with all of you. Baka kasi nakalimutan nyo na yung challenges natin and difficulties during the COVID pandemic, and they're once again haunting us or bothering us nowadays. And but in the meantime, we will first be talking to someone regarding the forecasts of the Department of Agriculture regarding rice sufficiency, and kung sino ba talaga sa DA ang dapat nating paniwalaan at pakinggan, because it seems that there are questions regarding where and what data is the DA spokesperson quoting from regarding rice sufficiency. So we'll tackle that later. But first, I'd like to remind you today is a Tuesday, December 19, 2023. It's 8:03. Let's start our day with the Daily Starter. And it goes. Pili po ito ni Gabriel. To stand anew, let go of the weight that held you back. That is so true. Kung kayo po kasi ay maraming baggage from the past, baggage in the present, okay? Hindi kayo basta-basta makakatindig. You cannot just stand up and go or move forward because you are weighed down by so many things. You have to let go of the weight that held you back. So, hopefully, in the new year, marami sa atin makakalaya na sa mga pabigat sa buhay natin. So, let's continue with that thought. To stand anew, let go of the weight that held you back. And in the meantime, let's go to the front page of the Philippine Star. Forgive me, I'm going to make a quick run of it because I'm not sure for how long my throat and my voice will allow me today. Medyo, and kung pumapawis po ang Kuya Cito, forgive me because no aircon is going to ease the fevers, etc. Anyway, BBM upset but won't seek China invoice recall. In spite of the many suggestions and calls from high-ranking government officials, the president he said he may be personally upset by what has been described as the hostile behavior of Chinese Ambassador Wang Xilian, but President Marcos said he won't seek the recall of the envoy because the Philippines cannot afford to commit the mistake that may cause a huge problem. Okay, so that is Diplomacy 101. Mag-usap bago maghiwalayan. At the top of the front page, Typhoon Kabayan or Tropical Disturbance Kabayan strands 5,400 sea voyages suspended. Marami po tayo mga kakilala hindi nakabiyahe dyan sa bandang Bisaya. Marcos on 2024 budget, secret fund issue already settled. Tapos na po yun, bagamat tinatanong pa rin ng ilang mga journalist o reporter. Anyway, Tagle identity stolen, used to sell aircons. The name or identity of Luis Antonio Cardinal Tagle has been stolen and is being used in marketing gimmickry to sell tsaa, portable air conditioning units, and even medication for rheumatism. Pag may nakita po kayong mga demonyong gumagawa nito, i-report nyo po sa kinaukulan, sa DTI, sa CBCP, etc. Main big picture on the front page of the Philippine Star, that young lady with a basket full of flowers is a student performing a dance routine to formally open the 2024 Panagbenga Flower Festival at Baguio City Hall grounds yesterday. It is the 28th year of Panagbenga, a term for a season of blooming. Kung aakyat po kayo ng Baguio, please be reminded, may color coding po sila. Bagamat kulang sila sa karatula, may color coding po sila sa Baguio, and may multa po. Last I heard it was 500 pesos. Wala nang parking, pagkatapos may color coding pa. So kami nagbubus na laang. Meanwhile, center photo, Philippine woos Japan ASEAN investments in renewable energy now open to full foreign ownership. The renewable energy sector is ripe for picking as a viable investment according to President Marcos. Meanwhile, transport strikers mull Christmas campout at Malacanang. Striking drivers and operators are mulling to spend Christmas in front of Malacanang amid the December 31 deadline. Okay, so yan po, gusto nilang magpasko doon sa may Menjola. Okay, meanwhile, we have South Expressways. See more traffic for the Christmas season because of the opening of more exit tolls that connect travelers to many tourist destination. Ayan na po, no? They expect double-digit traffic volume. Big photo, Disney on Ice, 100 Years of Wonder. Mickey Mouse and his pals invite Disney fans to join them for skating fun and a trip to their favorite Disney destinations. 100 years na pala ang Disney. Last but not the least, Senator Loren Legarda joins Quezon City District 2nd Councilor Mikey Belmonte at a stall of the Murang Bigas Handog Pangkabuhayan program, which provided residents with 20,000 worth of affordable rice for their startup business. Meanwhile, Barangay Bagong Silangan Chairman Willie Cara, Dole NCR QC Field Office Martin Hequinto, etc., distributing rice packages to Dole Kabuhayan beneficiaries in Payatas. Ayan po, no? Namimigay ng bigas, ng pera, at ng ayuda. Okay? Bigas na ayuda. Ano kaya ang masasabi ng ating bisita? Parang ang daming bigas sa Pilipinas. We'll now go for a break. And after this, we will talk to our first guest regarding ano ba talaga? Will we have rice in 2023 or highest bidder ang labanan? We'll be right back here on Agenda.
The Agriculture Department says that the Philippines will have a stable supply of rice until the next harvest season in March or April of 2024. DA Assistant Secretary Arnel de Mesa said this after the warnings of the Federation of Free Farmers, which forecasted that the rice crisis may be worse in 2024 compared to 2023. De Mesa explained that the country is expected to hit a total of 20 million metric tons of palay production before the year ends. The Philippines also earlier imported 295,000 metric tons of non-basmati white rice from India. Meanwhile, President Bongbong Marcos has ordered the coordinated implementation of all government plans to mitigate the effects of a strong El Niño. Moderate to severe drought conditions are likely from February to May of 2024, potentially affecting the country's water resources, agriculture, energy, health, and public safety. How can the agriculture sector prepare itself for the stronger El Niño next year? Let's find out on today's agenda.
Raul Montemayor is the national manager of the Federation of Free Farmers Cooperatives Incorporated, a nationwide federation of agricultural cooperatives in the Philippines. Montemayor is also a private sector advisor to the Department of Agriculture.
Good morning, bigla, no? Sir Raul Montemayor.
Yes.
Welcome to the program agenda.
Yes, magandang umaga din, Cito, and I hope you get well soon.
Thank you very much. I do hope so. And let's get straight to the point. Yung pinag-uusapang supply of rice. Sabi ninyo sa Federation of Free Farmers, kakapusin tayo that it might be the worst ever in terms of deficit stock for rice and palay. Now, this gentleman, spokesman ng DA, si Mr. De Mesa, has always said, under Assistant Secretary Arnel De Mesa has said there is sufficient rice, there will even be a record of 20 million metric tons. Now, sino ba talagang papaniwalaan dapat ng publiko dito? Ano ba ang batayan ninyo versus sa pinagsasabi ni ASEC De Mesa?
Oo. Well, we don't necessarily contradict each other, but we have to put his statements in context. No? Unang-una, yung 20 million ton record harvest, it is only 1% higher, assuming makuha natin yon, 1% higher than what we produced in 2022. And it is almost the same volume that we produced in 2021. No? So it's not a big deal actually if we hit 20 million. No? Pangalawa, when he says we will have enough rice until the next harvest, our next harvest is in March. Yun yung dry season crop natin na tinatanim na siya ngayon, no? And then our stocks, katatapos lang ng ani natin, so we have a lot of rice now, tama siya doon. And that rice is supposed to tide us over until we start harvesting again in March. No? Ang sinabi nila, by end of December, we will have 85 to 90 days stocks equivalent, no? So that's 3 months, no? And that will bring us to March na meron pa tayong konting natira, assuming tama yung calculations nila, and then mag-harvest tayo ng March. And then pagdating ng July, August, September, babalik na naman tayo dun sa lean months hanggang mag-harvest ulit tayo ng October, November, December. Ganun po yung cycle niya. We have a March, April dry season crop harvest, and then we have a October, November wet season harvest. No? So our rice has to be able to be enough to tide us in between these harvest seasons dahil wala tayong harvest during that time. No? So ang sinasabi namin, in 2024, there are two major factors that were not present in 2023. Number one is El Niño. No? Depende kung kailan tatama yung El Niño yan, baka hindi masyadong tamaan itong dry season harvest natin, pero malamang tatamaan yung wet season harvest later in the year because that means there will be less rain. No? If the drought happens in March, that is actually good for palay because it's harvest time, hindi siya masyadong maulan. No? Pero kung drought na by March, April, and then pagdating ng Mayo, yan yung taniman, walang ulan, mapipiligro yung October, November harvest natin later in the year. That is our problem, assuming we don't have a problem during the first quarter. No? Eh, pangalawang development na wala masyado nung 2022 is the persistence of high international prices. which will discourage imports. No? Even if we produce 20 million tons, we still have to import about 3 million tons because kulang yung 20 million tons sa pangangailangan natin. And that has to be supplied by imports. Ngayon, papasok ba yung imports next year kahit mahal yung bigas? No. And then you have the new law that will penalize supposed hoarders and smugglers with economic sabotage. No? Napaka-tindi yung wording ng law that if you have a lot of stock, even if you're not really hoarding, pwede kang kasuhan kagad at ipadlock yung bodega mo. No? Again, that could discourage imports. No? And backfire against our moves to address the supply problem. No? So
okay, Sir Raul, before you go any further, can we put context here? Sabi nyo kasi malaking the second factor would be in importation and international prices.
Yes.
For 2021 and 2022, how much were the average going rate per metric ton of rice from our neighbors?
Noong 2021, naglalaro siya ng $450 per metric ton.
Okay.
Okay. 2022, in the first half, okay pa. Tumaas ng mga 500. But in the latter part, umabot siya ng $650. So from $450 the year before, umabot na siya ng $650 at present. No? So malaki yung tinaas ng mga
But
50%.
according to what I picked up, yung huling bentahan o bilihan ng Vietnam was at $700+ per metric ton. And this is under normal circumstance, walang El Niño factor, which is a global phenomenon. So, am I correct in presuming that the international price rises will go beyond 700 to maybe 750? Or more?
Huwag sana, no? But that is a possibility. No? And by the way, Cito, you also have to add in the freight costs. No? So that might explain why my 650 became 700. No? But ganun din ang feedback namin pataas. No? And there is a lot of positioning by importers trying to ensure that they have enough stocks just in case tumama El Niño sa kanila. So medyo nagkakaroon na rin ng agawan sa international market, and that will drive prices up.
Okay. So let's go to your third point. I think you had the third point you wanted to raise.
Well, yun actually yung dalawa, yung El
Okay.
Niño
Yung
and then
dalawa.
prices. So,
Okay, now nag-react ang Federation of Free Farmers regarding the statements or the suggestions of Arsenio Balisacan of the NEDA that the government should maintain the low tariffs, etc. Anong dahilan? Bakit kayo nag-react negatively sa suggestion ni DG Balisacan?
well, kasi 3 taon na yan na binaba nila yung tariff, no? And they had good objectives, and they wanted to bring down the price of rice by encouraging more imports from non-ASEAN countries like India and Pakistan. And they wanted to diversify our sources kasi 90% of our rice comes from Vietnam and Thailand. Pagka sinakal tayo ng mga yon, wala tayong ibang tatakbuhan. So the idea was to encourage more imports from non-ASEAN countries so that we will have a more stable supply source. No? Ang sinasabi namin sa kanila, maganda man yung objectives nyo, the data for the first 3 years from PSA and Bureau of Customs shows that your 2 objectives were not met. No, prices did not go down, and we did not diversify our sources because the imports from non-ASEAN countries average only 4% of total imports during those 3 years. No? And in the meantime, we lost 1 billion pesos in tariff revenues. No? So, ang sabi namin, bakit pa nyo papalawigin yan when the data shows it is not effective in achieving your objectives. You're just throwing away money, and that money is supposed to go to farmers under the rice
But
tarification.
what about the political agenda? I mean, is it possible, and I suspect it's the only reason they're doing this, is to keep the natives happy and peaceful, ika nga, to prevent the Filipinos from raising hell over the rice.
You know, most of the rice that we bring in from India and Pakistan are not even the regular rice for consumers. No, they are the basmati. And then dahil binaba natin yung tariff, pati yung mga Haponica ng Japan, pati yung Calrose ng Amerika, yung mga mamahaling bigas na sinoserve sa mga 5-star restaurants, nakinabang din sa 35%. So we're scratching our head. Do these people need tariff relief, no? For these types of rice? Why give them that privilege? We lose money, the farmers lose money, and we don't gain anything in terms of lower prices or a more diversified source of rice for the country. No? So parang it doesn't make sense for us, for an economic manager, to continue such a policy that doesn't work and that costs the government in terms of lost tariffs.
Okay, I have to inform you that medyo meron din akong mga kaibigan sa loob. And I am told that the importations from India is not a done deal.
Yes.
That everyone is talking about importing from India, but the Indians are holding back, waiting for international prices to settle. Our hope in getting from Myanmar just got shut down because of the civil unrest there. So did you guys add this to your computation and projections that we're not going to be getting any rice from India till the end of 2023? And if not, when?
Well, in the past, India rice was significantly cheaper than Thailand or Vietnam rice. Mas mura siya by a wide margin, almost sometimes $80 per ton. No? Pero wala pa rin nag-i-import from India. No? Bakit? No? Because historically, the India rice has not been of equal quality versus Thailand or Vietnam rice. No? And then, baka dahil malayo ang India, hindi sila suki. They are not a traditional supplier. So importers would rather stick with their sukis in Vietnam and Thailand. No?
Mm-hmm.
So now we're getting 295,000 special quota from India. As you said, will there be takers? No? Depende sa price, depende sa quality. No? And kung walang magpapasok niyan, saan tayo kukuha ng bigas? Because we have to import next year around 3 million tons. No?
Should the government do that?
Alin po yung pag-import?
Oh, government importation.
Technically, under the rice tarification law, hindi na dapat nakikialam ang gobyerno sa importation. No? Although the law only mentions NFA. So if they really wanted to do it, they could probably use another agency to do the importation. No?
And the president can declare a state of emergency or calamity or need.
Yes. But maglalaan sila ng pera. Magpapalugi sila. Are they willing to do that? No? Because the whole idea of the rice certification law was let the private sector run that business, let them spend for it. No, and government will just take a step back and just monitor. No, hindi na siya makikialam sa price stabilization. No, yun yung isang malaking factor sa RTL. Bahala na yung market sa presyo. No?
Okay, so Sir Raul, is it safe to say my conclusion is that nalugi ang gobyerno by 1 billion, as you said, and then the traders have stopped buying because malulugi din sila. And then the rice farmers ay nalugi because they're not getting their share from that 1 billion loss. And finally, the Filipino consumers ang panalo, tumaba pero may diabetes na.
No, actually, the consumers did not gain anything. If you look at the price trends, even before this price spike, hindi naman gumagalaw yung presyo pababa despite the entry of cheap imports. No? And it is the importers and the traders who pocketed the tariff reduction, the savings from the tariff reduction. Silang kumita. No? It's a rice trader liberalization law, not a rice trade liberalization law. No? And that's what we have been pointing out to the government for a long, long time now. Let's review that law because it doesn't seem to be working in achieving the objectives that it was passed for.
Okay. Well, Sir Raul, thank you very much for your time this morning, and thank you for joining us here on Agenda. We do hope it is a better year for all of you, and I wish you Merry Christmas. God bless you and your family, sir.
Salamat din. Merry Christmas din sa iyo, Cito. Thank you.
Thank you very much. We'll now go for a quick break, and when we return, we will talk about the case of patient Beltran, who is currently suffering from COVID-19, with well-known doctors who have guested on the program during time and time again during the pandemic, COVID pandemic. We'll be right back here on Agenda.
The Health Department has recorded 2,725 new cases of COVID-19 from December 12 to December 18. That is 50% higher compared to the cases reported from the previous week. Right now, the Philippines has around 4,000 active COVID-19 cases. The Octa Research Group also reported an increase of people testing positive for COVID in Metro Manila over the past weeks. The positivity rate is at 13.4% as of December 10. What is the cause behind this uptick, and how can Filipinos ensure they go into the holidays with a clean bill of health? Let's discuss this on today's Agenda.
Dr. Rontgene Solante is a respected infectious disease expert in the field of medicine. Solante holds various chairmanships in different hospitals. This includes the Section of Infectious Disease and Committee on Infection Control at Medical Center, Manila, and Adult Infectious Disease and Tropical Medicine Fellowship Program at San Lazaro Hospital.
Good morning, Doc Rontgene Solante. Welcome back to the program for a familiar topic of discussion.
Hi, Cito. Good morning.
Okay, yes, I am COVID positive since Saturday. And I'm wondering, Doc Rontgene, I'd been talking about the spread of COVID yet again, but people don't seem to take it seriously. They don't wear masks. And worst of all, sasabihin nila, trangkaso lang, may ubo lang ako, may sinisipon lang ako. Pagkatapos yung pala nanghahawa na sila ng COVID. Could you explain could you share your observations regarding this problem?
Yes, no, Sir Cito, no. This is an expected event, no. In fact, in most other Asian countries now are experiencing increase in the COVID cases, aside from, of course, the other respiratory viral infections, no. At napaka-importante dito yung pagtanggal natin ng mga health protocols, no? And I think this is the indicator na pag wala kang, hindi ka nagmamask, and at the same time there is now an increase in the cases, mabilis talaga ang hawaan ngayon. The other thing that I would like to mention here is that even if you are vaccinated, okay, our vaccine has already lapsed in terms of efficacy, no? Now, the vaccines that we have had before will never anymore can protect us against the infection, no? But somehow, nandun pa rin yung protection siguro na we will not develop the severe form of COVID, no? But right now, Sir Cito, no, the current strain or the current variant is mostly related with a very mild type of COVID. And rarely you can see patients being or having a severe form of COVID. Kaya ito na yung nangyayari sa atin na just like other respiratory viral infection, nakahanay na siya dito sa influenza-like illnesses, kagaya ng flu, kagaya ng respiratory syncytial virus that you cannot anymore determine kung may inuubo sa tagiliran mo or sa harap mo, COVID ba yan or hindi. Parang hindi mo na ma-determine, no? So I think one good aspect, good news here is that most of the COVID positive that we have now sa mga nagpakonsulta sa amin are mostly mild, self-limiting, 3 to 5 days, nawawala na. But again, nandun pa rin yung kabako pag halimbawa 60 to 70 years old. Hindi mo naman masigurado na tuloy-tuloy magiging mild yan. There's always a tendency that they can go into complications with COVID.
Well, exactly my point, Doc Rontgene. Kasi my next question was going to be, was it a wise decision to label or to tell people na if you have been vaccinated, you will have a milder form, it will be shorter, quick recovery. The COVID variety out there is now the mild variety. Was that a wise decision? Because as you're about to point out, yung mga senior citizens, people with comorbidity, immunocompromised, pregnant, etc., pag tinamaan yan, I was reminded of all the people we buried or we mourned for during COVID, and we didn't think, we could not even imagine people dying from COVID, but they died. So parang thinking ko, tama ba yung ginawa natin na parang hindi naman natin binaliwala, but we minimalized COVID?
Well, ang nakita ko lang talaga dito, hindi naman natin na minimalize ang COVID, no? We look at the data, no? When we look at the data, there is really a significant decrease in the cases compared to the previous month, no? Malaking bagay yun. And that's the reason why the WHO declared the lifting of the public health emergency, because it's not anymore a public health emergency. meron na tayong mga natuklasang gamot, meron ng mga bakuna, and there are now mitigating measures na pwede nating maiwasan ang pagdami ng pagkamatay, no?
Mhm.
Kaya nga, ang sabi ng WHO, it's not anymore a public health emergency. It will now be considered as a long-term disease. Kumbaga, nandito na yan. Kasama na yan sa influenza, kasama na yan sa tuberculosis, kasama na yan sa pneumonia na we need to deal with it. And at the same time, kailangan respiratory viral infections. September, October, November, there is a co-circulation of different viruses. Hindi lang COVID to kaya nga tumaas ang ILI data natin, no? COVID, influenza, respiratory syncytial, and the other unnamed viral infections, halo-halo na yan. Dagdagan mo pa ng gatherings, dagdagan mo pa ng mga other mga parties, pangalawa, dagdagan mo pa na hindi tayo nagmamas, expected talaga yan na we will always experience this ganitong pagtaas. Pero ang gusto kong sabihin lang dito, Sir Cito, no, na despite this event, ang nakikita pa rin namin on the ground sa mga hospital, hindi ganoon karami ang na-admit because of COVID. So medyo doon tayo
Yeah, pwedeng i-manage sa bahay kung with doctor's guidance. But you know, in our case, nagpunta talaga kami sa Rizal Medical Center para magpa-RT-PCR, which is the other issue I wanted to raise. Shouldn't people at least buy test kits and test themselves at home? Kasi parang binabaliwala na, and then trangkaso lang to, and then may ubo lang ako, and then and that was the suspicion of one of my friends kasi we were together, and when he noticed that someone in the it was just a lunch, nung napansin niya yung isang ka-lunch namin may inuubo at sinisipon, lumayo na siya. Hindi siya nagpahalata, and then he told me when he heard I had COVID, hindi kaya si ganito ganon kasi you know I was kind of suspicious that there was something wrong. Kanya lumayo ako, sabi ko walang yaka, hindi mo man lang ako kinalabit, ako tuloy ang tinamaan. But you know, in all seriousness, should people start keeping stock of test kits bago naman magmahala na naman yan?
Well, ang thoughts ko on testing is really I'm more liberal about testing. Bakit, no? Because before when we do the test, it's mainly because driven by the fact when you are positive, kailangan kang maggamot dahil pwede kang mag-severe or pwede kang ma-hospital. Ngayon kasi, if you will be testing yourself, ano ba ang purpose ng testing mo? Dahil lang mag-isolate ka, dahil lang para lang malaman na may COVID ka at hindi mo mahawa yung iba, may not be so practical at this point in time kasi mahal din ang testing, no? But if you feel that
it's about 300 to 350 per test kit.
Yes, like for example, turuan natin ang publiko, pag magpa-test ka, dapat pag nag-positive ka, turuan mo rin yung sarili mo na you have to isolate, mag-mask ka, or if you're vulnerable, iinom ka ng gamot. But if you don't want to be tested, then tuturuan pa rin natin na, sige, you have to protect yourself, mag-mask ka para hindi ka naman makahawa. That's the reason why I'm not so parang fan about testing at this point in time.
Yeah, well, I have to be on the other side of the coin kasi as for me, I'm a senior citizen, you know, and so is my wife. And if you have children at home or if you have people who have comorbidities, mabuti na yung may heads up ka na teka, maliban doon sa kahinaan mo, yan, may tama ka pa ng COVID, so mag-iingat na especially. And of course, you don't want to infect others because I think that's the worst. During COVID, the COVID pandemic, I think every one of us hated people, literally hated people who continued to go out even when they knew they were sick. So it's irresponsible for people who are sick. Kasi sa Japan nga may sipon ka lang or ubon, di ba? Pinagsusuot ka na ng mask or magsusuot ka na ng mask on your own. But anyway, so do you think the increase of COVID-19 cases will continue in the next so many months?
Yes, Sir Cito, no? Basing on the current data now, na may mga bagong variant ngayon na nanganganak na naman si XBB to another several variants, no? Yung binabantayan natin ngayon, yung EG.5 at saka yung JN.1, which is now posing more than 50% of cases in US and Europe, no? Bakit nila alam yun? Because they continue to test, they continue to do genomic sequencing, no? So yun yung mga information na nakikita natin. So it's still very important that we need to remind the public, no, that COVID is still with us at talagang mag-iingat tayo, especially sa mga matatanda. I would just like to give you another data na na-release lang the other day. In the US, tumataas ang mga hospitalization rate nila for 70 years old and above. So ibig sabihin, alam na natin na itong mga matatanda will always be the vulnerable. Now, we need to put that in the context na sa atin mismo, dito sa bansa, we need to protect and we need to give some advice sa mga matatanda na they have to be also careful and have to protect themselves.
Okay, and doon po sa inyong mga nasasaktan sa sinabi ni Doc Ronji na mga matatanda, tanggapin na po nating matatanda na tayo. Salita po yun ng pagmamahal at pag-aalala. Kasi some people become touchy when you call them old, elderly. But the fact is we are more susceptible to infection than the rest of the population. But Doc Ronjin, after everything we've discussed right now, what can people do? Should we really go back? Ako, I'm sorry, I'm going back to face mask. The only time I'm not going to wear the face mask is in the farm or in the beach or in the province kung walang tao. But what should the case be right now? Airlines, boats.
Well, ang advice ko pa rin dahil ang ano natin is really on optional face mask pa rin, no? So hindi naman tayo nagmandato na mandatory ang face mask, no? Pero ang una kong i-advise sa mga sa population, no, sa katauhan, unang-una protect yourself. Okay? You should know how to protect yourself. Pangalawa, don't be limited by the fact na tumataas ang mga influenza like illnesses or COVID. This is the time to enjoy Christmas, but when we enjoy Christmas, we should also think of ourselves palagi yan na hindi tayo magkakasakit, no? Aside from protecting ourselves, go out, attend the Misa de Gallo, attend to parties, but please when you are symptomatic naman, give due diligence naman to be responsible na mag-face mask ka or huwag ka munang mag-attend dahil meron kang sintomas.
Okay. Well, Doc Ronjin, maraming salamat sa payo mo. Thank you very much for joining us today. I'm glad you're doing well. And I do hope you and your family have a Merry Christmas and a prosperous New Year. Take care. God bless you.
Salamat, Sir Cito, and Merry Christmas also. Bye.
Okay, well now go for a quick break yata and we go to our next guest who is going to talk to us about another problem that people like me are encountering after getting COVID. That is the problem of finding medicine, the most prescribed medicine for COVID-19. We'll be right back here on Agenda.
former independent director of the Philippine Health Insurance Corporation, or PhilHealth.
Good morning, Dr. Leachon. Welcome back to the program agenda.
Good morning, Cito, and good morning to your televiewers. Magandang umaga po.
Okay, thank you for joining us. And as I was already explaining and discussing on the program, I got COVID, and I also discovered that a lot of people have had COVID but did not share it publicly. So the awareness factor is really low. A lot of people have been happy, presuming they have influenza or meron lang silang lagnat, ubo. I got COVID, and one of the things my good doctor, Dr. Kath Santos of RMC prescribed was molnupiravir. And isip ko, okay, sige, let's go to Watson or Mercury or wherever. To my shock, it's not available everywhere we went. Wala talaga. And in a desperate attempt, someone suggested you go to this hospital, private hospital. Sila na yung pinakamalaki. I'm sure they have. And true enough, they had. But it's been a challenge. Ano bang situation talaga dyan, Doc Tony, dyan sa most prescribed medicine na molnupiravir?
Well, yung molnupiravir, before this particular upsurge nitong last quarter of the year, available naman. And between molnupiravir, there's another one by Pfizer, Paxlovid. Kaya lang the Paxlovid is so expensive and it's not available here. Then meron din siyang mga adverse event, pwede kang magkaroon ng rebound. So molnupiravir is our drug of choice for 3 reasons.
Mhm.
One, it was accessible. Number 2, may generic siyang counterpart. Yung Paxlovid would range to 20 to 25,000 per course. Itong molnupiravir, you can get it from 2,000 to 3,000 pesos lang per course. And then, ang number 3 reason, it hastens the recovery based on one study. Yung 4 days from 15 days, nababawasan ng 4 days. So, may malaking pag-aaral. Ngayon, ang problema niyan, for transparency's sake sa mga kababayan natin, you know naman, I used to work in the pharmaceutical industry.
Mhm.
And I had a chat with Danny Chong, who's the president and CEO of Watson's.
Yeah.
Talagang mataas ang demand. Even azithromycin or Citromax, na out of stock yan eh. So dapat, ang sabi ni Danny, Doc, sabi niya, ACL ang tawag sa akin eh. Sabi niya, ang problema kasi, mabilis bumenta, that's number 1. Number 2, limited ang expiry date niyan, 6 months. So in the corporate world, usually we have a weekly meeting of the inventaryo. Kung mataas ang market demand, then in our past life, sabihin ni Arjeb or ni Mr. Bacaro doon, and then si Joe, di dapat yung inventaryo nyo ayusin nyo. So that meron kang mga supply niyan. So I remember that eh. So therefore, the Department of Health, knowing the certain upsurge right now, should talk with the industry. PPP to eh, public-private partnership eh. One of the lessons I've learned in the last pandemic is the lack of collaboration ng public-private sector. Kaya napanis sa maraming gamot kasi the practice should have been pagka landing ng bakuna mo at the airport, dapat sinasalo na yan ng babayaran mo na admin fee lang through Swilly, Mercury and Watson's, and then distribute it properly. So para hindi magkaubusan. And then may checklist ka ng mga gamot na mas madaling maubos. You remember during the Omicron ultimong cup preparation, gamot sa lagnat at sipon, nawawala. And I heard Rontgene Solante na this will roll over till February kasi based on seasonality, mataas ang COVID, ILI, walking pneumonia sa last quarter of the year. But since in the Philippines, ang pinakamalamig natin January, February, magro-roll over yan until mawala ng summer because viral transmission is increased during the cold weather situation. And because of the lifting of the COVID restrictions in China, yan ang most traveled population. So makita natin based on history, kumalat yan sa Taiwan and then the rest is history. Ako, Cito, I just got back from the US, so 17 to 30, and wala na nagmamas.
Mhm.
Pag landing ko ng connecting flight ko sa Taiwan, 90 to 100% nagmamas. So I look at the Taiwan website, ang advice ng Ministry of Health nila, if you didn't have COVID vaccination, flu, and pneumonia box, don't go to China. Kasi you will be flirting with fire there kasi ang taas ng admissions. And then travel to. Since walang border control tayo, what are we going to do? So narinig ko si Rontgene, you have to protect yourself. Wala tayong mandatory face mask, but we should actually be aware.
Okay. Sorry,
about it.
Doc Tony, pasensya ka na. I'm just running out of time here. But quick question. What happens if a patient can't get access to azithromycin or to molnupiravir?
Well, they have
ano magiging outcome ng kanyang disease?
Well, siyempre, mahirap gumaling at may probability magkaroon ka ng long COVID syndrome. Yung persistence of symptoms, way beyond the time na dapat magaling ka na. And that's very punishing kasi regardless of the severity of symptoms ito, patients can have persistence of brain fog, shortness of breath, chest pains, a lot of things eh. Kaya ayaw natin magka-COVID because of the auto.
Yeah. And yung problema, Doc Tony, ang mangyayari, maraming hindi nagpapatest or hindi nagse-self-test, and then kahit na mag-self-test, hindi naman makakuha ng gamot, di magkakaroon sila ng long-term COVID.
Exactly. Kaya a lot of patients naka-recover na. Pag tinest namin sa clinic, ipapa-stress test namin, echocardiogram, normal. And yet may hapo. So dapat ngayon, pagka meron kang flu-like manifestation, magpa-COVID antigen test ka and then isolate and then get a molnupiravir right away. Kung hindi ka gumaling, then you might have a walking pneumonia pag chest x-ray. So ngayon, may solusyon naman eh. I think Secretary Ted Arbosa should meet the pharmaceutical industry and the medical community. Rontgene is the president of the PCP, then called the PPS and the Lung Society of the Philippines, Philippine College of Chest Physicians, and then the Mercury and Watsons, and then tinan na inventory with Swillig. And then ensure that there should be supply until the next 3 months. Ganun ang pag-inventaryo nito.
Okay.
So ganun lang ang strategy niyan.
Okay, so it's all a matter of inventory management, which can be done by a big company like Zwillig, and we should not allow patients untested, whether self-test or RT-PCR, and even worse, the untreated, unmedicated. Doc Tony, thank you very much. Hayaan mo, next time, habaan natin konti. Kinakapos na rin ako ng hininga because I am on my 3rd day. So, thank you very much, Doc Tony. I hope you have a healthy Merry Christmas and God bless you, Doc.
God bless you too, Cito, and happy holidays.
Okay, that's Doc Tony Leachon, otherwise known as ACL, in his past life in the pharmaceutical industry. So he really knows what he's talking about. Let's now go to our blessing from the book of Psalms, chapter 91, verse 9 to 10. If you say, the Lord is my refuge, and you make the Most High your dwelling, no harm will overtake you, no disaster will come near your tent. And yes, tinamaan ako ng COVID, but I see no harm overtaking me, no disaster coming into my house. And I praise the Lord, and I wish you the same. And I thank you for joining us today. Please, you've heard all the wisdom, the advice. Do take care of your health, because that is your greatest wealth, second to God. Thank you. God bless all of you. Please keep it here on One News.